About this Delaware rate study for HCBS, home health and home health and personal care services. This session is being recorded and will be uploaded in the upcoming week or so on the DMMA website. As just general housekeeping items, please make sure to keep your mics muted. We will open it up to questions at the end, but if you along the way have something that you want to capture, please feel free to enter it in the chat, which is on the bottom of your computer screen, and we will make sure to address it as we're going forward. We will get further into kind of the purpose of today's town hall and the overview of this rate study project and what, most importantly, we need your assistance with as we get into the next few slides. So with that, I would like to introduce, next slide, please. Drew Wilson, Michelle Stant, and Melissa Smith, who are working with Mercer on this project. I will hand it over to you, Drew, to say a few words.
Yes, good afternoon. Great to see the folks who could make it here today. Most of you know me that I prefer to be more conversational, but for the sake of my accuracy, I'm actually going to risk reading at you, so I apologize in advance, but bear with me. So good afternoon. My name is Drew Wilson. I am the Director for the Division of Medicaid and Medical Assistance. Thank you very much for joining us this afternoon. We look forward to a productive town hall and are grateful already for your partnership as we conduct this study. Our division has contracted with Mercer to assist us with this project, which is funded by the American Rescue Plan Act, or ARPA. We are glad to be recording this town hall to make it shareable amongst your colleagues and able to be revisited in the future. That said, we're here as a resource and partner throughout the study, so please do not hesitate with questions. There will be an email for a resource box provided at the end of the presentation. This study is targeted to a limited set of services, primarily delivered under managed care, mostly known in Delaware as Highmark Health Options, Amero Health Caritas, and now a recent third, Delaware First Health. This study is not intended to encompass all home health and personal care services. This is one small but important part of a greater effort to better align reimbursement with the cost of providing your important services. However, we acknowledge that there is often overlap in the workforce for HCBS services. We would like to encourage over-participation in this study, as all of your insights are valuable. Some key goals for this project are to help us better understand the costs associated with providing your services under managed care and to develop benchmarks for comparison to the current reimbursement levels. This project will only succeed with your assistance and input, which again, we are so grateful for. With that, I'm glad to introduce Director Melissa Smith of the Division of Services for Aging and Adults with Physical Disabilities.
Thank you so much, Drew. And I don't have prepared remarks, so I will try to get it accurate as I speak on the fly. I'm really happy to be a partner to this project, acknowledging that so many services that we provide through our division are similar to the services provided under the MCOs, and knowing that we share a shared provider pool, we are taking notes. We are looking to the results of the rate study to inform our own rates. And so while there's language that refers to Medicaid recipients, please know that we are watching and looking to learn from this experience as well, so that we can mirror some of the progress made on our end. So thank you so much, and I'll turn it back to you, Amy.
Yeah, thank you. Appreciate it. So welcome again. My name is Amy Korzanowski. I work at Mercer as a consultant, and I am joined by my colleagues, Holly Brown and Leslie Lee, who will hop in intermittently throughout, particularly when we get to some more of the nuts and bolts of the survey itself. So if we go on, I'll kind of take some opportunity to go through today's agenda. Just to give a high-level overview, we're going to talk about this project. We're going to talk through a little bit about the objectives and the timelines, what this means. Introduce to you the provider survey, which will be coming shortly via email. And then again, as I mentioned, open it up for questions and discuss any next steps. So if we go a little bit more about the background of the origin of this particular study. Drew mentioned it. It's a part of the American Rescue Act, which is essentially to expand, enhance, or strengthen HCBS services. Delaware submitted a spending plan to CMS, and this rate study specifically was approved. This project will study payment rates made to DSPs. And I just want to call out, because this has been a conversation that we've had with DMMA, that we understand that DSP can mean a number of things, but for this purpose of this project, this terminology refers to the individuals who provide the direct care for the 6 services in home health and personal care services. As mentioned, DMA contracted with us at Mercer to review the current Medicaid payment levels through managed care. We're going to gather, as mentioned, key input from you all, as well as compare that data, compare the information to publicly available data related to provider costs that we can bump up against. If I can call your attention to a couple of the key project outcomes, if a takeaway for you all is that we are planning to deliver to better understand the costs associated with providing these 6 services. And Mercer plans and will deliver rate benchmarks up to these 6 services for comparison to your current payments. So that is the key project outcomes we're talking about today. And if we can go on, I will share a little bit the curiosity of what are the 6 services. These are the 6 services that this study is solely focused on. As you can see, they're listed here on the screen: attendant care services, chore, companion, homemaker, home health aide, and respite. Also, for clarity, we've put in the procedure codes in case some of you that's most familiar. We have included that as well, so you can see exactly the services that we are talking about within this study. And really, what this project ultimately is going to look like for you as a key partner and stakeholder within this process. So first, thank you for participating in today's town hall to learn about this and to understand what it is that DMMA is hoping to accomplish. We are starting by introducing this project, and then at the end, we will bookend this project by actually sharing what the results are of the survey that we complete. The next piece, if in the middle of the slide, you will, as mentioned, be receiving a provider survey that will walk you through collecting some costs of delivering services that we just talked about on that former slide. And then lastly, we will also be conducting a separate MCO survey to glean some additional learnings from the MCOs that we might not have readily available in the claims data that we have. So really trying to kind of pulling it all together, as mentioned at the top, we are evaluating the payment claims data and other publicly available data, cost information. But I want to emphasize that the information that you have as provider experience with the service and the cost pressures are really most helpful getting from you. A couple things in particular is that we want to assure that what you are seeing and experiencing in real time align with what we are seeing with publicly available data, as well as what we're seeing in the claims payments. This will kind of putting these 3 all together will inform our rate review process and benchmarking, which will afford us the opportunity to provide these insights to DMMA to inform the rate review team. So very critical. If you haven't picked that up, and this is your input is absolutely necessary as a part of this process. Just to hit a timeline, here's a high-level view of the engagement timeline. As of right now, we're in the town hall. We're doing the kickoff. Within February and March, the next 30 to 45 days, we will be asking for your feedback, as well as the MCOs on their feedback through a survey. And then, as mentioned, we will bookend with a recap of our learnings from this project. And then the next slide kind of gets into a little bit more of detail, just so you can have an idea of the different steps that we're taking along the way, going from left to right. This timeline really kicked off the end of last year, the beginning of this quarter. We're reviewing we have the list of service rates, as we discussed, and are reviewing relevant legislation and regulations. The next step 2, we are going to be exploring behind the scenes rate methodologies. Next, we are starting to look at other rate benchmarks that can be applied. step 4 is where we are at today of kicking this off, introducing you all to this, and then also showing and introducing you to the survey. The next step is with the provider survey. When you receive it, you will see in the information an email, which we welcome. If you have any questions, you're welcome to use that email. It will be on the slide deck as well as included within the email that you received to complete the survey. With all this information, Mercer will be collecting, processing, and incorporating everything, all of your information into the claims and the publicly available data that we just discussed. We will then develop draft benchmark rates, and we'll discuss with DMMA what those comparisons look like to what we're seeing with the actual current payment rates. We'll draft a report that states discussing some rate methodology options and final results. And then, as mentioned, we will end with sharing the results with you participated within this process as a part of the HCBS ARP spending plan initiative. The next piece, I would like to hand it over to my colleague Leslie, who's going to give an overview of what this survey looks like and some additional details. So I will hand it over to you, Leslie.
Thanks, Amy. So as Amy mentioned, we will be sending out a provider survey, and because getting the cost information from the provider community in Delaware, specific to Delaware costs and the challenges there, is really important to us. So again, we really appreciate you joining us and participating in this process. So after this, sometime after this meeting, we'll be sending out an email with the slide deck and the survey as a PDF, and then also a link to the survey. And so we ask that you complete the survey that we're sending out by March 15th. And then we will take that information back and process it as part of that rate benchmark development process that Amy described. So we'll show you what the survey looks like now, and then we can talk through what the questions look like. And so on screen, you'll see a link. When you receive the link to the survey, this will be the page that opens up. There's a little bit more of the background information there, and also the email at the bottom there for any questions, or if you're having technical difficulties, please reach out to us via email. And then there'll be a couple sections to fill out. The first section will be the provider demographics, just some key information for your provider or your agency's profile, and also some contact information in case we need to reach out after looking through the data, and then some other basic profile information. And then as you go through the survey, there will be specific sections that appear, and we can talk through that, I think, a little bit easier through the PDF, which we'll also be sharing. So this PDF will be sent out because there are some questions that may need some additional research or a little bit of homework on your end to gather. We will be sending out the PDF or the survey in a PDF format, so you can see all the questions before sitting down to complete the survey. So you'll see that introduction blurb, the demographics section, and then after the demographics sections, we'll get to some general questions asking about like staffing and admin costs, other benefits and things like that are associated with just providing services in general. And so that's what the general information section is. So you'll see there we have questions on like how many full-time or part-time employees does your agency provide, benefits, etc. So all the way through the general information section. In this section, the intention is to understand what your agency looks like as a whole. And so looking for like totals and general numbers regarding these questions. And then we'll get to the section where we're asking about the services specifically. So if we keep scrolling down, Let's see, I think one more page. So we'll get to the section of the service specific questions. And the way the survey works is it'll first ask you, does your agency provide this service? And so for instance, in question 20, it'll say, does your agency provide attendant care services? If you check yes, then some questions about attendant care services will show up, such as staffing ratio, and a few other questions. If you select no, then the survey will skip over the section on those services. And so as you look through the PDF, you'll notice that the questions, there's a lot of questions, but it's because we wanted to include every single service on here. And so you'll only need to answer questions that pertain to the services your agency provides. I think we'll keep scrolling to the end over here. Because these are the service specific questions. And then the last section of the survey is just some general comments. So we wanted to provide a space for your agency to provide feedback on concerns that you're seeing regarding the workforce for these specific services. So things like recruitment, retention, or wages, you can give us that information in the section here. And then any other comments you would like to share with DMMA for these 6 services that we are looking into, home health and personal care services. So as I mentioned, there are some questions on here, such as like total costs associated with training and, your full-time staff and part-time staff numbers that may need some research outside of this survey. And so we will be sending you this PDF so you can see all the questions, gather your homework, and then when you're ready to complete the survey, you can click on the link that we showed earlier, and we'll be sending out via email, and then fill out the survey, and it'll submit to us, and we will be able to take that information back. Amy, did I miss anything there?
You did not.
Okay.
So we'll pause. I know we do have a question in the chat. So I'll ask for attending care in the survey in general, how will home employers under self-directed services be captured since the DSPs are not employed by the agency providers? And to clarify, Pam, you asked this question, that would be specific to one of the service codes that was referenced up above. Is that correct?
Yes, that is correct.
Okay. I'm not sure that I have that answer right in front of me, but I will defer if someone from DMMA or my Mercer colleagues, we need to take that back and follow up.
Yeah, I'll just add to that, Amy. So I think for that question, we will be looking to understand what the wages are for the self-directed services. We do want to understand that as part of the study. So that may be something that needs to be called out specifically in the survey, and to make sure that the survey is distributed to the appropriate parties so we can gather that information.
And then I also wanted to add to that, this provider survey is also just one part of how we're approaching an understanding of these rates. We're also, as Amy had mentioned, asking MCOs to complete a questionnaire survey to help us better understand those services as well. And there will be other sources that we explore so that we can capture as best as possible the information around all these services, including the self-directed services.
All right, so if we could go to the last step, really, I think, and thank you, Barb, for kicking off the questions. Is there anyone else that has a question with the information, overall process that was just shared? Or any other questions that anyone would like to ask at this time?
Yeah, hi, this is Rob Latin at Bayada Home Healthcare. I have a number of questions and comments. First of all, thank you for this presentation. It's very clear in terms of what to expect and when to expect it. I want to say that this timeline feels wholly insufficient. March 15th is 1 month from today. We have not even received the survey. It could take weeks for large organizations to get this information based on the infrastructure process. So, this meeting only happened 1 week from announcement. That is not enough time for home care community members to gather this type of data. So I don't know if there's flexibility in that, but one of the problems that you may find if you don't build in the time is that you just won't get the information. And if you rely solely on managed care companies and things like that, it's not going to paint an accurate picture. This is also true of the information that you receive, because I would, having helped work on internal surveys, that some of it's not going to be right, and hopefully you'll notice that and have to respond back, and that there's time built in for that kind of thing. So I'm hoping maybe that can be. I should also just add that also the legislature is in session over the next 4 weeks. This is traditionally a very busy period of advocacy for this community, and this probably could have been done with better timing. So I'll just leave it at that. But I do have some actual questions, which are previous rate studies on these codes were passed as part of the 2019 budget in the legislature. Melissa was there for all of that. I'm probably giving her PTSD, but I asked because that rate study wasn't set up to decide benchmarks. It was set up to decide rate methodologies to develop benchmarks, if that makes sense. It was not going to say the rate should be X, right? It was going to determine whether the methodology in place in Delaware for said rates was appropriate based on all of the information. My first question is, it sounds like this study plans to both do that as well as define a rate. So is there going to be any intersection between that study, which took thousands of state dollars and thousands of people's hours? And I'm not saying we should use that one. I generally think it's probably dated because of COVID-19, but I'm just bringing it up because this community is fatigued from this type of exercise, generally speaking. I do have another question. Would it make sense to answer that first and then move on, or should I put it all out there?
Why don't we pause and first talk about the timeline, and then I'll probably defer to one of my colleagues about the question that you asked. The timeline we'll take back in regards to the amount of time to provide the information back. We do have a set period with the HCBS ARP spending plan that dollars need to be allocated. And we do recognize, I hear you, of how that aligns so you can best advocate. Totally get it. So we're trying to get some of this information pulled together and provide it out so you have that future to be able to advocate. But recognizing and hearing what you're sharing in regards to fatigue and the timing element. So I hear you with that.
Yeah, and it's also just worth noting that this rate study was commissioned with little to no input from the home and community-based services. We had different recommendations for how to use that ARPA funding. And frankly, I had completely forgot that this was even commissioned. And then, so you can imagine what that's like. And just to be clear, I'm the legislative chair for the Home Care Association, which is kind of why I'm being so direct. But we just want to make sure that everyone gets what they want to get out of this, right? And I think from speaking with Drew that buy-in from stakeholder input is going to be important. So it's just important that we allow certain runway. Sorry, I interrupted.
So your question was how this particular survey, this particular project intersects with a project back from 2019.
Is that the first time that you were hearing about said project?
I'm trying to make sure I understand your question.
Yes. So there was a rate study that was commissioned as part of the 2019 budget in Delaware. It was vast. It wasn't just these rates. It was private duty nursing. It was like all forms of home and community-based services. And it, without getting into too much detail, it was frankly being used as an obstructionist tool to raise Medicaid rates that hadn't gone up in years, like decades. And work was being said that it was being done on it, but it wasn't transparent on any level. And there was little to no stakeholder input. And then eventually it just kind of died. And so we don't really know. And so I really just ask, because if your intention is to use that methodology, we're going to have thoughts about that, because that methodology is pre-COVID, right? And probably dated. And so I think just for transparency's sake, it's just kind of important to have it in the back of our minds about how that kind of thing's going to be incorporated here, if at all. It might not be.
Yep. No, thank you for bringing it up, Rob. So we are aware of the study that was conducted for DDDS services in particular. So I do want to say that, you know, we are reviewing that study as part of this reimbursement review for DMMA reimbursement. It is something we want to be aware of, make sure there's parity between agencies and divisions and reimbursement to DSPs or direct care workers across the state. So it is something we are looking at. But I wouldn't say that we're necessarily applying the specific conclusions from that study to this one.
Right. And if you do go into more detail, and this is really more for Drew than it is for you, I think, we did find errors in the way some of that data was compiled in terms of kind of looping in certain attendant care that wasn't really attendant care. And I'm being general. I have it written down in all my notes from previous conversations. But if you do really start taking that into consideration, we should talk about it, because there was some errors in terms of following the money, and how it all got grouped together. Anyway, I digress.
And I'll just hop in really quickly overall and say, I think fundamentally we are committed to kind of getting it as right as we can. And so to the extent that there are experiences from your community, and there's, as we go along here, it feels like there's needs to be more time. I mean, I think we're certainly open-minded to get to, so it's not a question of just finishing the project. It's about to get to a product that will work for us all. This is really, we're viewing this as a collective effort. And so we're definitely here to be open-minded, and we're definitely here to hear feedback. We want to have an open door throughout the entire thing. You know, we certainly would be glad to hear additional experiences. But at the end of the day, we're trying to really listen. Like we're trying to be a good partner here.
Appreciate it. And if it sounds like I'm being combative, it's not because I dislike anything you're saying. It's just we've all been down this road before, right? And so we're trying to get ahead of some of these things with as much runway as possible. So we appreciate everything you do. I've worked with Mercer in other states before. So, you know, thank you for all your help.
And certainly I also wanted to not gloss over something you said before. I mean, fatigue is real in this space, and it was a long pandemic. It was a long pandemic, and providers are tired. I mean, pretty much anybody who touches Medicaid is tired, and we understand that, but we're hopeful that a study like this will help us sort of bring some positive energy, bring some collegiality, and help us move the whole industry forward for the benefit of all of our Delawareans.
We do have some other questions in the chat, but Rob, you mentioned you might have another question. So did you
No, I want to defer to others. I don't need to take up all the space. Thank you so much.
Of course. All right. So we do have a question and a comment in the chat, or a question in the chat from Anthony, mentioning that DSPs and self-direct may fluctuate between part-time, full-time as authorizations change. Perhaps consideration given to be how this report will, how we will report this with respect to full-time, part-time. I will defer to Leslie or Holly, but essentially we're taking averages. So we have an idea of proportion to benefits of full-time, part-time, and trying to understand just collectively what that proportion is. We have an idea of benefits being offered. Holly or Leslie, any additional context or commentary you'd like to share?
No, I think that's right, Amy. It is the main intent of that question is so that we can allocate benefit cost accurately as possible. So that's really the goal.
And just to comment on the fluctuation, we understand that throughout, the year or time period we capture, there will be some fluctuation in, the proportion of part-time and full-time and all of the other things that change throughout the year. And so we understand we're just capturing a small slice of time, but we just ask that you do your best to give us like an average, over the year, as typical as possible to your costs.
All right, we have one, Pam, I see we have a question. We'll go to Pam. You have your hand raised.
Thank you. It actually relates to Anthony's question and to my prior question. So when we're talking about self-directed services and in particular, looking at the agencies that are providing fiscal management services, where it's a home employer, right? Those home employers are under this program are typically, hiring 1 or 2 attendants each. So when you look at, and I'll use Easter Seals as an example. So let's say we have 100 home employers. All of those home employers who have attendants, those are their employees. We manage the fiscal portion of the process. So they're not receiving benefits. They're simply wage employees to that home employer. So for us to answer that question, there won't be any benefit costs for that home, for that attendant under a home employer. And the authorization that's provided from the MCO, just as Anthony says, can fluctuate. And you could have a single person that works for 2 different home employers. If you put them together, they might be full-time, but that still doesn't mean they're getting benefits because it's a different model than other services, but it's a fairly substantial number of people in this state between the 3 FMS fiscal management service providers. So I just want to, I think there might be some more conversation specific to that particular population, because it's not going to fall in line with what you're getting from a BIATA or other home health agency where there are potentially benefits included.
So maybe just to clarify one piece with that. So the agency that would be providing that information would be providing just for that individual that's working part-time, because that's what they know. And they would answer those same questions of how many part-time employees they have full-time, as well as if they offer benefits. So essentially,
yeah,
part-time, full-time, or not at all. And that is a question. That is a question on there as well.
Okay, I probably see, and I look to my other SDAC FMS providers here to help with this one. I think the majority, the people that are served under an FMS model are not going to have benefits regardless of their part-time, full-time status. They are employed by, if I am a person at home and I have had and I'm hiring my own attendant, I am the employer and I have one person working for me, and Easter Seals is helping to manage payroll, taxes, and that sort of thing. But there's no benefits to that attendant working directly for me. And we're talking about, for the program as a whole, we're talking about thousands in the state that will fall in this category.
You said it well, Pam. You're looking for help, but
Go ahead.
I think you framed it correctly.
Thank you.
So I think that what I'm hearing is that the self-directed services, like the profile of those employers or the agencies managing those employed through self-directed services are going to look different, right? And so just understanding that there won't be any employee related benefits. As Amy mentioned, there is a question there, or one of the responses in there is saying we don't have employee related benefit costs. And I think what would be helpful is if in the general comments area where you're identifying any additional comments for us, just identifying your agency as a self-directed agency, and that will help us kind of parse out, you know, who is working under self-directed and who is not. And in that case, then we can kind of see what the differences in the agency profiles is. Is that helpful?
Mhm.
Okay.
Thank you.
This is Michelle Stant with DMMA, and also listening to Pam's question. Is there, and please correct me if I am incorrect, but I'm trying to really hear it. There's self-directed through your agency as well as just a traditional employer-employee model. Does there need to be an additional layer of detailed reporting around how the self-directed is different than the traditional full-time or part-time employee model? I see Pam nodding, and as much as I'm always reticent to change a survey or ask for additional reporting, because that is also additional work for your agencies, but I know that the self-directed is so critically important to the service model these days. Pam, is that kind of what you were trying to get at as well?
Yeah, I think I would not want to confuse both models under one survey for our, I mean, we're unique in that we have, you know, both of those models here. But even so, just that whole self-directed piece with the home employer is just very different. And that really does need to be sort of separated out from standard agency DSPs and how that works.
Okay, I think that I'm fairly confident in saying that we'll take that one back and we'll look at how do we parse that one out in a clear way to ensure that we can capture the data around self-directed and how there's some intersections, but really critical ones that inform how services are provided. And everything that I hear from the community and from our members is that this is really critical services. They all are, but self-directed is definitely something that we've got to ensure that we pay attention to.
Okay, thank you.
We had a couple other, one other message in the chat. The MCOs from Francis of the MCOs authorized recipients under attendance services. However, providers are providing the G0156 services such as mechanical lifts, but they're not getting reimbursed at those rates. How do we capture this information? Wondering if Francis, you can expand on that
Yes, I guess
a little bit.
what I'm trying to say is a lot of our, you know, we're no matter what level of licensure we're in, and we're getting homemaker services, but we're providing the same, we're getting same as authorization as another agency who cannot provide a mechanical lift, but are being the rate is the same, right? The reimbursement is the same under the attendant, but we're providing a higher level of service for the Medicaid recipient. So even, I mean, this is goes back to the MCO not authorizing it the right way, but they won't authorize it. So there's, we're getting people, providers are providing a service at a G0156 level, right? But are only getting reimbursed under the S5130. I'm actually looking at my camera the wrong way, so I'm sorry.
Okay.
Does that make sense? So it's really hard to capture that we are providing a higher level of service, even though we're under the S5130.
Yep.
And
So,
oh, go ahead, Amy.
no, go ahead, Leslie.
I would say, so I think what would be helpful is like this kind of feedback is very important for us to be able to understand like what is going on with like the services and at the various coding differences. And so in that general comments area, if you could please put that in there and say that like, there's coding inconsistencies or we're not being reimbursed at the appropriate code level or whatever it is that, other concerns that you have listed, that would be really helpful for us so that we can understand, potentially these rates are showing at X dollar amount, but really they should be, this much because the coding is inconsistent or there's other costs to be associated with it, if that makes sense.
Yeah, I guess that goes to my secondary question below is because the level of licensure, you have to have an RN oversight. Only those agencies are allowed to provide mechanical lifts and home health aid services. So I think we need to capture that different levels of licensure comes with a little bit more expenses because of the RN oversight, et cetera.
Yes, that's super helpful to know. And again, like if we're able to capture that in like the comments and additional, information that you would like us to know, like this all helps us think through how best to match the benchmark to costs as we are experiencing them in the system.
Right. Is there a way that we could add that as an option? Because putting it in the comments, wouldn't that be difficult to extrapolate instead of like all the skilled licensure have these expenses and home health aid only licensure have these expenses and PASA has these expenses. So it kind of breaks it down a little bit more. Just putting in comments, I think you're not going to get as many people extrapolating that information with expenses. I think just the different levels come with different requirements and the cost increases with that. I mean, I just a comment. I mean, you can take that back but I think it is important because it's not one size fits all in Delaware with our 3 license levels. So I think it's important, or the regulations really drive a lot of it.
See, there was one other question about, will overtime costs be captured within the survey? We do have a section for other costs, but Leslie, I'll defer if, you want to speak to this.
Sorry. And Holly, feel free to jump in. I was just gonna say that I didn't want to skip over the conclusion to what I believe Francis was saying, that we will take back your comments and discuss how to adjust the survey to incorporate some of these other issues that are being brought up to our attention as well. And as far as OT, I believe we have a question in there capturing any additional costs to providers outside of just the typical wage benefits, like the typical wage pay that we are looking at for DSPs.
So overtime, or if you're doing sign-on bonuses or retention bonuses or pickup bonuses.
Yes.
This is Rob again, if it's okay for me to ask another. Well, really, it's less a question and just another statement. I feel like this is our one time to get some of this stuff across, so I want to make sure it's on the record. So 2 things kind of related to the same thing, and this is really only relevant to some of those certain home care attending codes that were up there, is that last year the legislature provided additional funding to some of those codes that has not yet gone into effect. So this is an assumption, I could be totally wrong, but presumably when you do your local market research, I'm sure local market research plays into both methodology and kind of the baked in recommendations. That is not going to be an accurate depiction of the market right now, because the market is due to go up like 16%. It's like 6 months behind that. It's supposed to go up. And one of the things that has been holding that up is that there is not officially a fee for service rate for some of these. So there is a debate that has been going on for about a year and change about what that actual benchmark rate is. And I'm sure if you ask a managed care company what that benchmark rate is, they would tell you something different than what Bayada would tell you, right? Because they're a for-profit entity. Bayada is a for-profit entity. Everyone on this call that's not a knock. That's just the system. but there is an understood rate that I think by and large has been accepted. But for the purposes of like a negotiation, for instance, we have found that suddenly people conveniently forget, right? And so I say that because this is the primary rate which this study is going to explore, and that is critical to. And I can just tell you what that benchmark rate is. It was $26.52 originally after one rate ago, and now it is. Forgive me, I should just have this up in front of me. It should be after the last increase, $32.52. Based on our advocacies, that's again still up for debate because it's not been completed. But my point is not to debate these numbers right now. My point is that they are not settled, right? And so when you are kind of going through this, I hope that the market rate, the localized market, will be more properly reflected to what it actually is, right? Does that make sense?
Yes. And I actually, thank you for pointing out, the various numbers there and then the different information that's available out there. And we have heard all those numbers being thrown around. We've also been made aware of the fact that there are increases coming through. And so we intend to take not just, we're asking the MCOs and we're asking providers and we're looking at our encounter data from the state. And it's all part of the rate development process. We're not just going to take a number from one source. We're looking at, publicly available data, such as like the Bureau of Labor and Statistics, inflation, all of those other factors that go into a rate that we will be accounting for this benchmark. And it's not just coming from one source. We're trying to gather as much information as possible, which is why we're putting out this survey. We'll be asking MCOs, like I mentioned, and then also looking at the publicly available data.
Sure. I guess my point is what I'm saying is not like really publicly available, right?
Yes.
Like there's no fee schedule. That's part of the problem, is that there's nowhere in Delaware where it says this was the benchmark rate, right?
Yes.
Because it has neither gone into effect nor is there a fee schedule written down anywhere. Does that make sense?
Yeah, absolutely. And that's part of the challenge and why we're trying to gather as much information about these, rates or these services and the challenges that providers are facing so that we can also incorporate that along with legislation and make it as,
Wholesome as possible.
Exactly. Yes.
Thank you for your help.
Francis mentioned about mileage payout. We have heard this with some other clients that we've worked with. I think there is some areas in the survey as well. If there's particular pain points, that absolutely call that out. And that can be something also to note when you're completing that. Pam, Pam is a good student, raising hands. Thank you.
I'm well trained in Zoom.
There you go.
Too much usage. Thank you. I'm curious if you would be willing to share some of the questions that you will be looking to garner, or some answers that you'll be looking to garner from the MCOs. What will their questions look like? What are the topics around the MCO survey?
So I think we can share in general, like what we're asking for. So we actually do have questions around self-directed services and how MCOs are deciding those rates or contracting those rates out and paying them. So we have some questions understanding self-directed services. And then we also have questions in general of just criteria for how they reimburse these rates. Just trying to get a better understanding of how these things are decided, because as we've mentioned, there is no published fee schedule for some of these rates. And so we're just trying to get a better understanding of how these decisions are made, essentially.
And thank you, Leslie. I'll tell you, sort of share where I'm going with that. Our contracts with the MCOs as a provider are typically confidential and proprietary. That's been the feedback that we've always gotten from DMMA when we were saying, could you help set DSP rates? And they're like, nope, that's between you and your MCO, that we can't step in, that's confidential. And so now I'm a little anxious about the potential that we're shifting, and that with a publicly shared survey, that confidential information will now no longer be. Is that the plan, or is that not, did I miss the mark on that?
So we are gathering that information for this purposes of the study, but we do intend to ensure that, the confidential information is not publicly shared. All of this information will be just included as part of the rate study, and we'll come out with a benchmark rate. And I don't want to speak for, what DMMA is comfortable or not comfortable sharing, but, we intend to ensure that all the confidential information stays that way.
Thank you, much appreciated.
There was a question or comment about how this survey will get distributed, concern about one email isn't enough, getting lost. Definitely hear you on that, Rob. Yes, it will be emailed. We will do a follow-up email. I'm not sure if we are planning to do one follow-up or two, enough to poke a little bit, but maybe not to be harassing. Any other questions? We have some good information to take back for sure. As we finalize the survey questions and get them out.
I have one more question about after Rob's email, about the email. Who is it going to? Is it like the administrator of the license? Like who in like Beata is going to get it for Beata, or?
Yeah, we have been working with DMMA and their partners to get these sent out, so I'll have to defer to that distribution list. I see your note to me, Pam, about that you didn't receive the notification.
Right. So that's where I'm concerned so we didn't know about the town hall meeting. I found out about it from a friendly competitor, which is always good, right? So just making sure that this survey somehow gets to all of the right people. If the town hall notification is limited, it sounds like from Francis, you may be feeling the same way, then just making sure. And I sent you my direct email. You're welcome to send it.
Thank you.
Also, would it be helpful? I mean, the survey is the survey. We could also make it available electronically. As you know, we're recording this with the idea of again, airing as much as we can towards transparency. We could post a link to the survey at the same place that we post a link to the video for people to come back to. It doesn't change the fact that we need to somehow get all that information out. So I don't want to get stuck in a cycle of just having resources somewhere that nobody can find. So certainly open input on the best way to get information out, points of contact and emails. If there's information that we can give you to put on Facebook pages or social media, we're here to help us make this a successful and transparent project.
I mean, I think all of the above, right? I mean, I almost view it like how Medicaid redetermination has been handled, right? Which is like everyone gets the benefit of the doubt that the onus is on the entity to communicate, right? So every available avenue for that. And to your point about having potentially two different types, right? One like you send us, and then but one that's also just on your website that someone could just click on. That all sounds really good. And I think I can speak for the association when I say that like it's something that the more you have on it, the more we can send it around to the various providers.
Yeah, I appreciate that. Yeah, I think again we're erring towards making it as broad and public as possible, and we're certainly erring on getting it right.
Any
So
additional?
when will we next hear from you? Assuming that there's a communication, like, is the next time we're going to hear from you when you have a prepared survey, or are you going to design a survey that fits that addresses some of the requests or issues that were brought here to kind of make sure that it's properly captured, or you're just going to take this, develop it, and the next time we hear from you is when you're sending it out?
And so I'll speak, and then if DMMA has anything to add, they're of course welcome to jump in. But we have a survey draft, or we have a survey ready to send out. However, given some of the feedback that we've received today, maybe we'll take it back and discuss internally, just to make sure we're properly capturing the information that we are intending to capture with this, and send out the survey early next week. Does that sound reasonable? Not trying to speak for DMMA here.
We would first connect with DMMA to look at the updates that we've made, see if we're all aligned with, does that capture the spirit of what we've talked about today? But the intent would be to send this out next week. So that would be when you'd be hearing back from us, Rob.
So then please.
Go ahead, Rob. Sorry, I didn't mean to step on your
Oh,
side.
It also, what it sounds like is also that there's no flexibility on timeline. And forgive me, I don't know the details of ARPA spending, but is there is it just by the end of 2024, or is there a specific charted date within 2024 that the fund must be spent by?
I can answer the last part first. There is actually an expenditure date. It can't even be allocated. It has to be expended by, I believe it's the end of March, for the timing. But that said, I found this town hall, and I don't at all mean to say this to try to close us, because I'm learning a lot today, and I really appreciate everybody's engagement on this. I know that I sound a little bit like a broken record, but like I can speak just for myself, which I guess at this point is not for DMMA, right? Like, we really want to get this right. And so I think what I'm prepared to do is to go back and we can debrief, thankfully it's recorded for our purposes too, really sort of distill down the feedback relatively quickly here, and then decide on a next step. I mean, certainly what Mercer has iterated was what we put on paper, but this is not, we're willing to make this, we're willing to be flexible at the end of the day. And so to the extent that we've heard feedback here that has been incredibly helpful, there's, we want to be, again, transparent, and we want to make sure this works. And so, we'll take it back, debrief. If it makes sense to sort of share a survey, another iteration before we just send it out for a continued feedback. Certainly, we would want to make sure, again, that we're listening, and this has been incredibly helpful.
Yeah, we really appreciate your flexibility. I know I speak for everyone when I say that.
May I speak? I couldn't find a way to raise my hand here, so I just...
Yeah, I get lost on it too sometimes, different platforms. Like, where are the buttons?
Yeah, I appreciate that. And I'm speaking right now strictly from a self-direct standpoint. There's a tension between what costs are and what costs are thought, what it's conceived that costs should be. In other words, in our contracts and dialogues with the MCOs, we feel that perhaps costs should be higher because the attendants should be paid more. And that is certainly an issue that's, they have their constraints, et cetera, et cetera. And that's something that we try to work out with each of our funders. Is there a way in the survey to indicate that? I'm a little nervous, quite frankly, about saying, hey, here's our costs. But really, they don't meet the need at a direct care provider level. They are what they are because that's what exists. That's the funding, that's the payment rate that exists. But there's a tension between that and where we think the market says it should be. And I think it would be great to be able to present that somehow. This is where we want to get to. This is our goal. This is what we think is a thriving, competitive, healthy, retention-healthy environment, as opposed to, here's what our costs are.
Yes.
Am I getting that across?
Yep.
Well?
Yes, absolutely. And as far as that goes, the initial cost information we're asking for is a baseline for us to be able to understand, like you said, what are the costs that providers are experiencing right now. And then, when we build a rate up, we take into account all of those different factors. So for instance, we know that, the minimum wage is going up, starting in January of next year, I believe. And so we also know that there's the rate increase that's been passed. And all these different pieces of information we gather are going to go into that benchmark rate. So we're not just going to say, you told us this is where your costs are, here's what the rate is going to be. And it's a small part of a greater effort to match the cost, what providers are experiencing, and also take into account all the different challenges that our providers are facing currently. And with that being said, at the end, there is a section, that general comment section, for you to share with us, like, this is the cost that we're experiencing. And our concern is that the wages are too low and we need XYZ thing. And that's what that section is for, is to get that qualitative information that doesn't necessarily come in through the data.
That'll
Does that
help.
make
That'll
sense?
help. Yeah, that'll put context on it. And that's what
Yes, exactly.
that's my concern. Sure.
Any other questions, comments? We heard you with the great feedback regarding the survey questions themselves. As mentioned, we will look at those and see how those can be redefined, connect with DMMA. We heard you about the amount of time to take the survey. So we will also take that back to DMMA and see if there's what potential next steps might look like. So definitely want to make sure this is collaborative. And as Drew has said repeatedly, we want to get this right. It doesn't help anybody to not get it right. Drew or anyone else from DMMA, any last words?
I guess I would say, and I'm not going to read it you this time. I'll actually talk to you. So, this is why like Delaware is such a great place to be, right? So we're all here and we're doing this town hall and we're able to react together and try to figure out the best path. Like we definitely want to be collaborative. We know the importance of the services that you provide, and we want to make sure that we are doing our role to ensure that our beneficiaries, almost a third of Delaware, have access to what they need. And so we take this seriously. We do want to, again, get this right, as everybody has said many times, but we do mean that earnestly, and that we do want to have this as just a continued conversation. So when we said town hall, we really mean town hall. So this isn't just a performative, like we're launching this, like town hall to listen. So really appreciate everybody's engagement on this. And we definitely want to continue to communicate and be an open door. And really just thank you. Thank you for making the time today. And this won't even be the end. If we leave today and you sleep on it and you're like, oh, wait, what about this? Like, please tell us. This is not, we want to continue to talk. We want to continue to talk.
Thank
Melissa?
you.
Yeah, absolutely, Rob. Melissa, anything?
No, I just want to echo your comments. I learned a lot today just thinking through the impact on self-directed, and I have a lot of things to think through. So I'm pleased to be here as well and learn along with you all. And I echo Drew's statements that we're here to get it right and really value the feedback and the open and transparent conversation. So thanks, Drew.
Yeah, send us your contacts. We'll broaden our net as well. Please, let us know who you want to make sure that we include. This is almost in some ways like a social experiment for us as well, in terms of how can we reach as many people as possible. So really, value all sorts of feedback, really. Thank you.
Thank you all. I appreciate your time. Bye-bye.
Oh, and I guess I just lastly note for anybody who didn't see it at the bottom, I did promise at the top that there is a box that you can email to. It's on this slide. It's been here the whole time. I just want to make sure we highlight it. If you have a chance to write it down before everything goes away. Again, recording, so we'll post this later and get it out there. But I don't want to get stuck in the chicken and egg cycle of, well, no one knew where to find the recording. So thank you, Michelle. There we go.
Will you be sending this presentation around to the initial list of who you sent this invite to?
Yeah, I don't see why not.
Great. That'd be helpful.
Yeah.
All right, very good. Thank you so much. Have a good rest of your day. Bye-bye.
Thank you, everyone.